I'm thinking that there may be some employers who say, putting aside the issue of employee satisfaction, all employees like having their insurance provided by their employer, wouldn't an employer be financially better off to not provide insurance and take the penalty? I mean, when I put a pencil to it, the penalty that my firm would pay would be a fraction of what we pay for health insurance. Right. Tell me why I'm wrong.
Tell you why you're wrong. Well, that's a great question. Kind of two thoughts come to my mind. One is each example you'd have to work through the math, and you can. So I'm a little bit of a cynic, I guess, but you can guarantee insurance companies are working through the math right now too. If you think about, let's just take an example where maybe you have a $300,000 penalty. That $300,000 penalty is not a tax-deductible item, so it truly costs you $300,000. Whereas you could provide probably about $450,000 of health insurance premiums. You get a tax deduction for the $450,000, so it really only costs you $300,000. So that's kind of a little bit of quick math to say there are probably insurance companies doing that same math, saying what are our price points here, where when people do an analysis, it's going to make sense to go ahead and buy the insurance instead of paying the penalty. But I think that's part of planning. My hope is that people would provide health insurance. The reality is people in America get their health care needs taken care of one way or another. Of the center column earlier that we had, even today, those people get health insurance, and it winds up and gets paid for through the I would call them charitable contributions. That's not really what it is, but through the hospitals and the agencies that have to provide the care anyway, which winds up and gets paid for either by taxpayers or through donations from people. So, or reimbursed from Medicare. So.
Well, I think in addition to tag on to Terry's comment, because a lot of employers are going through that thought process. Mm-hmm. Historically, healthcare financing has been provided two ways in this country, through employer-sponsored plans or through government entities. And I think that this will create an environment where employers are going to get more creative when it comes to their benefit plans. And remember, we're talking about the medical portion of your plan. There are many, many other components to your employee benefits plan. And I think that unless we saw a significant number of the dominoes fall, in other words, employer upon employer upon employer just remove themselves from the health insurance financing market, I think it could create a very different competitive landscape. Because if the majority of employers do retain, which I believe they will, employer-sponsored plans, and you have an employer who opts out and chooses to pay the penalty instead, you're going to be competing for employers in a very different fashion as that employer that doesn't offer a plan anymore. Mm-hmm. And it's going to impact your turnover. And we're actually building out some financial models right now to help employers go through that calculation and determine what their tipping point is, where it becomes a disadvantage, a significant disadvantage to not continue to operate in the employer-sponsored health insurance arena. So there are lots of things that go into play other than the surface view, which is where everybody's at right now. Well, it seems to me, on the surface, if I took a pencil to it, I'd be better off to opt out. That's probably rarely going to be the case once you start going through a thorough financial analysis.